Lung cancer has affected people for a very long time. The first case was first documented back in 1500 BC. In 1761, lung cancer was officially identified as a disease. 1810, several characteristics were identified about lung cancer. From 1876 to 1938, about 60 to 80% of all miners died from lung cancer as workers got really sick in the mines, and they were called death pits. In 1878, people considered lung cancer as very rare, as only 1% of all cancers were lung tumors. By 1918, the percentage jumped up to 10%. By 1927, the percentage jumped up to 14%. In 1929, Fritz Nikind, who was a German physician, made the connection on how smoking can cause lung cancer. Lung cancer is now the second deadliest type of cancer. That was in 1940. In 2013, lung cancer became the deadliest type of cancer. Towards the end of the 19th century, many of the drugs used were from plants and minerals. The medical scientists wanted to create a disinfectant that would kill all the parasites in the human without actually causing severe damage to the human itself. As they didn't have anything that was really effective. Then, Paul Ehrlich made a big contribution to science by discovering chemotherapy. So how can science be used to solve this problem, lung cancer? Well, science can be applied in many ways, especially like the most popular chemotherapy and radiation therapy, which is the way to treat it. But one way when you're experiencing lung cancer, you should go on a certain type of diet and eat certain type of foods. You should choose foods with a lot of protein, like chicken, turkey, fish, eggs, milk, cheese, beans, nuts, soy foods, etc. You should have lots of grains, whole grain pastas, brown rice, oatmeal, etc. And you should have lots of fruit and vegetables. Now, chemotherapy can do a lot of good things, but it can also have a lot of implications. Take chemotherapy pills, for example. Examples of the pills are Femara, Odomzo, Jakafi, Hexalin, and Sutent. There are lots of side effects to chemotherapy pills too. They can be loss of hair, changes in your skin, easy bruising, feeling tired easily, flu-like symptoms, vomiting, and diarrhea. Implications of chemotherapy pills is that you don't have to go out of your house. You can take the pills at home. You have more privacy, which is a good thing, and you have less disruption in your daily activities, so you can hang out with your friends and family more. But the bad implications of chemotherapy pills are that the treatment is not as effective as taking chemotherapy and putting in your vein, injecting in your vein, and the side effects for chemotherapy pills are much worse. Now, the country that would need lung cancer solutions the most would be Hungary, as they suffer the highest death rate in the world from lung cancer. My solutions are to stop secondhand smoking, and you can do that by not allowing smoking in your house, don't allow smoking in your car, avoid smoking areas in the public, try to get smoking restrictions at work, and when you travel, get non-smoking hotel rooms and go to non-smoking restaurants. Another solution would be to avoid exposure to radon gas. This is the natural type of gas that can cause lung cancer. Exposure can mostly happen in schools, houses, and workplaces, and there should be good containment facilities, and things should be tested for radon gas. Another solution would be to know about exposure to asbestos. Again, this type of exposure can lead to lung cancer. Asbestos is located in paint and walls. It can be located there, and things should be tested for asbestos. A solution to this could be that the country should get good disposal systems. Another solution would be exposure to other carcinogens. This is a type of substance that can cause cancer in the tissue. Asbestos was a carcinogen, but the same solution, there should be good disposal systems.
Chemotherapy was implemented in the late 1930s, and at the time, an exact cost wasn't recorded, but we can estimate that it was very cheap, as $5 milligrams of Jacophi now costs about $13,000. And this graph shows that the price of cancer drugs have been increasing over time. Now in USA, it would roughly cost about $11,000 to $12,000 to treat lung cancer per month. However, with insurance, you can reduce the price to about $2,000. Chemotherapy costs about $10,000 per month, as mentioned before. However, 38% of the money is spent just on staying at the hospital. Since lung cancer is the second most cost death in USA, and by following the form of supply and demand, numbers of doctors and the increasing number of patients, doctors will have to increase the price as time passes, or unless they find a better way to cure the cancer. But as people spend more money, a hospital will be able to buy more and better infrastructure, such as equipment, bigger staff, and better supplies in general. This means that it can all benefit the economy globally, as the money spent on infrastructures, like mentioned before, can increase the sales of other organizations and companies such as hospital beds, lights, and also water. However, it has a very negative impact on the patient and their family, as they have to spend a lot of money on chemotherapy, and this might actually bring a psychological anxiety and depression, which might actually lead them to suicide at a worst case scenario. The country I've chosen is Hungary. This is because they, same as Neal, they suffer from the highest death rate in the world from lung cancer, and I have many economical solutions for them. So in general, they have to spend less money and save up. Governments can increase the tariffs on products such as meat and tobacco there. In 2014, 34% of all Hungarian men were current smokers. Increasing the tax means that less people will buy the product, and it could also give the government a lot of money so that they could spend it on other infrastructures.
Cancer has affected the world in several ways. For example, it has been estimated, and it's continuously developing, and it has been estimated that in 2020, in the US alone, cancer expenditures will be $157 billion. And so it's clearly at an increasing demand compared to 2015, where the total cancer care expenditures in the US were $80.2 billion. So that's almost a 100% increase. And this massive increase in cancer care demand, this demand for cancer care, it's affected political debates and economics globally. So, for example, it's affected political debates towards surge on drug use and certain procedures such as radiotherapy and chemotherapy. But specifically for lung cancer, there's a much broader range. For example, environmental problems are connected very closely with cancer, or specifically lung cancer, and global warming plays a massive role in lung cancer. So it's we can see it's a continuously growing concern. It clearly, economically and politically, has a massive impact. Also, the environmental aspect has a big political impact and is a very strong factor of cancer. So political environmental changes affect cancer. For example, certain countries, their economy is often centered in one industry, and that industry can quite often be related to oil and gas, and therefore harmful to the environment in several ways. And the country's economy can cause several environmental problems, which is directly linked to cancer. So politically, it has a massive impact. And now, lung cancer was originally regarded as an alien-like disease and was considered insignificant, like fake news. But its trend has been consistently rising. So the usage of drugs to reduce cancer cells has considerably grown a lot, and it's been a massive global. There's been debates globally about usage of drugs. India has the worst air quality in the world. This is due to car pollution and rising industrial emissions. So and that's also why India has such a big risk of lung cancer. And it is quite common. It's not very rare there. And now poverty also has a big impact in this. Factories, there are more people working in factories, and all the factories create pollution throughout the whole country. And also related to poverty, smoking has also had a massive toll throughout India and a massive effect in India's pollution as well. Now, this combination of events has developed the worst air quality in the world. Now, a solution to this could be economically and politically. For example, a major shift in India's economy to a more green and environmental friendly based economy. This could greatly and very positively affect the population of India, and it could also help prevent poverty in India, and it would be a good positive shift and good positive change for India.